The Bale-Doneen method addresses the inflammatory aspects of coronary artery disease and stroke by trying to find people at all different levels. We can treat them primarily if they haven't had any problems. We can treat people who already have plaque who haven't had an event and we're trying to prevent an event, or we can take people who have had an event and try to prevent another one from happening. So I think that one of the advantages is you can take patients at any level and still do good things with them.
The Bale-Doneen method addresses the issues of inflammation and blood sugar regulation and periodontal disease by specifically recommending the tests that be done, the levels that should be achieved, and the kind of alliances that need to be made in order to get patients optimal care.
The Bale-Doneen method really gives and arms the practitioner with a lot of tools to really assess a patient from a overall aspect in terms of not just looking at laboratory tests, but actually doing imaging, looking at CIMT scanning and knowing what those numbers really mean. So you can look at a person's physiology, but you've got to take it beyond that and you have to look at what's going on with their anatomy.
The Bale-Doneen method uses the iceberg analogy when they're talking about cardiovascular risk, and they really get to the heart, or what they call the root of the problem, and they're not just treating cholesterol. They're looking at all the other inflammatory markers and other disease processes that have an effect on cardiovascular events, and they focus on that. And I think that's a real paradigm shift of what current medicine is recommending.
I think what we'll see is risk reduction go way down. I think we'll see less strokes or recurrent strokes. We'll see less, better really primary, secondary, tertiary prevention is the bottom line. And I think we'll see less recurrence of strokes and heart attacks. I think really by driving these inflammatory markers, these lipids down, really dropping sugars down to a non-pro-inflammatory state, a non-dysfunctional endothelial state, I think what we'll find is that physicians will note that we're keeping them out of the hospital.
The public is demanding that they get something better for their health care, and I think physicians being equipped with good information as well as the public being interested in a different kind of health care is really going to drive a change. And most people, especially physicians, are not aware that plaque is not a normal part of aging, that decline is not a normal part of aging, and that there are things that we can do to halt or reverse those changes.
The pathophysiology of atherosclerosis has been known for years, 15 or more years, even down to the molecular basis. And we're only now beginning to see, I think, that although atherosclerosis is a man-made disease, you can certainly alter the course and the outcome of atherosclerotic disease, both medically and with lifestyle. And the emphasis within cardiology needs to shift to this if we're going to be able to continue to provide and survive in the current healthcare climate.